Okay, so we're going to go over some things that are important when taking a PA. So first of all, we have our machine here. Um, it's important that you have it on the correct setting. So here, let me show you when it first comes on what the numbers are. So when it first comes on, it's going to say 320. So this is the adult setting. So there would be the child setting. But we need it on the adult setting, but we need it to say 160. And in order to do that, you'll see this here is film. So we need it to go digital, and then that will change our number to 160. It's important that you have it on this correct setting, because if not, what can happen is there's a connection lag between the computer and the software. So your x-ray may not come up, or it may take a moment. The other thing is that if you are taking an x-ray, sometimes you'll get where you get the dial that comes up on the computer screen, and you go out of the room, you take the image and you hear it beep, but then the dial on the computer is still spinning. In that case, usually the only solution to that is going to be exit out of WinOMS. You may need to restart the entire computer. Most times you can just exit out of WinOMS completely and reopen the software, and then it will work. If that doesn't work, you're gonna have to restart your computer. So, also with your x-ray arm, you want your x-ray arm pointed at the head of the patient. So you never, sorry, this is a little bit difficult to do with one hand. But you never want your arm pointing away. So right now, this is kind of angled at the window. So you never want that pointing away, because it just creates unnecessary weight. So you want it to be focused to where it will keep this centered. If you do it the other way, what happens is eventually this becomes it becomes out of balance. So then you'll place your arm, and then it'll eventually start to kind of just slowly drift away. It gets a little bit of a lag. So in order to prevent that, just make sure you're pointing the arm at the patient. The other thing that you can do is, let's say you have the head of your patient here, but the arm is just not getting to where you need it. So down here, you have a little lever, so you can pull this, and then your chair will move and allow you to get the head farther over, so that way you can take your image. And then you just want to make sure when you push this back that you really push it into place so that it doesn't move. So we're gonna go into the other room really quickly. This room 3 here. So this one, when we turn this one on, all of these will kind of have different settings, even the ones in Chantilly, but usually we'll just keep it on T1, and then, pull your arm over, get that positioned correctly. The other important thing to note about taking PAs is the blue tape that is the barrier for the x-ray button. So what we do is we tent it up. So to us, this lets us know it's clean. So if somebody were to ask me to help them take a PA, I know I can touch this button with my bare hand because that blue tape is clean. Where, well, both of these are clean, but let's say I have dirty gloves. My dirty gloves can touch this because there's a barrier here. So if I had my fingers in somebody's mouth, saliva, blood, and then I push this down and I push the button. So now that this is no longer tented and we can see that it's touching here, that means somebody has touched it with dirty gloves. So if then they try to take it with their dirty gloves and they can't get it, they ask for help, I come into the room and then they say, hey, go ahead and push the button. I would never touch this with my clean hand because I see that this is dirty. So if it were, a case where they really needed me to help, what I'm gonna do is just peel this back and then push the button. because it's dirty, so I can't touch it, or otherwise grab a glove. But you know, in any case, just pull it back and push the button. And then when you're cleaning a room, you know, just always make sure that you tent that. It's kind of sloppy with one hand, but you just always want to make sure that's tented up, because then we know it's clean. So if you're ever walking through the office and you see that it's pushed down, go ahead and change it, because maybe somebody forgot, which we never should. That should always be a part of flipping our room. But if you ever see it like that, just make sure it gets changed.